I'm Dr. Rena Malik, urologist and pelvic surgeon. Today's podcast is all about low desire. We talk about how often we see low sexual desire. In fact, is it more common in women like we suspect it is, or is it pretty similar in women and men? What changes do we see in the brain of people who have low sexual desire? And what's the role of testosterone in sexual desire? What are the causes of low desire? And what are the number of different things that can affect desire? And how can you assess for those and improve those? I then go over tools and techniques that you can use to improve desire at home. We also talk about the role of diet as well as supplements in improving desire. And lastly, I review pharmacologic treatment options for low desire. I hope you guys enjoy. Low sexual desire. What exactly does that mean? So it's typically the lack of motivation or interest in sex or the desire to have sex. Now, this can be absent spontaneous desire, like you see your partner, you want to have sex with them, you used to feel that way and you no longer do, or even responsive desire, being intimate with your partner, and then usually that used to spark some sort of interest or excitement in sex and that no longer does. It's also the absence of motivation to try and go have sex. So some people will say, I used to actually want to look sexy or try to initiate with my partner, and I no longer do that. But the most important thing is that there is bother associated with that low sexual desire. Because if you or your partner are not bothered by the absence of desire, well, then it's not a problem. It is totally normal for you as long as you are not bothered by it. Now, how common is it? Well, in women, we see rates of women describing low sexual desire or low libido as high as 40%, but only about 12% are bothered by it. In terms of men, we see it in about 8 to 15% of men. So it's not uncommon in men, it's just less talked about. So interestingly, there was this study done to look at low sexual desire comparing men and women. And the way they did this study, which was done in 2007, was they took both men and women and they randomized them to give answers that they thought were going to be reviewed by a peer group, give answers anonymously, or give answers that were going to be hooked up to a lie detector test. Now, it wasn't truly going to be hooked up to a lie detector test, but they thought it was going to. And they asked about 200 people questions like how often they masturbated, did they have a partner, did they watch pornography? And interestingly, when the group thought that they were going to be reviewed by peers, women tended to often answer in the negative. Whereas when they were being told it was going to be anonymous or go through this bogus test, the lie detector test, they more often answered and had more similar answers to their male counterparts. And so through this study, the belief is that essentially men and women tend to have similar sex drives. Now, this study was done in a younger age group, so this may not be true throughout the lifespan, but essentially starting out seems to be that men and women have similar interest in things like masturbation, pornography, and having sex. So when you think about desire, desire is really complex. And there's a number of different areas in the brain that are involved in sexual desire. So when you are interested in having sex, parts of your brain light up and release certain signals. One of the most common ones is dopamine. And this is balanced by sexual inhibition areas. And these are typically areas that light up most often after you've just had sex, you're satiated, you're not in the mood to have another round of intercourse or sexual experience with your partner. And these involve a number of hormones, mainly being serotonin and even opioid receptors. So when we think of having more inhibition or less inhibition in some cases, if you're thinking about hypersexuality, and there's issues actually in those areas of the brain. In fact, they've done MRI studies of women, and they've looked at areas that highlight or light up when they're shown erotic videos. And women with hypoactive sexual desire disorder, which is essentially the clinical condition associated with low sexual desire, these women actually had less of these sexual excitation areas light up. Knowing this, certain medications can actually alter desire. So things that may decrease dopamine, increase serotonin, or increase stimulation at opioid receptors can cause decreased sexual desire. So the first thing you want to think about when you're seeing a patient or yourself are having sexual desire is, are you taking any medications that could affect desire? These can include things like SSRIs or antidepressants, antipsychotics, opioid medications, or even benzodiazepines like Valium or Ativan that tend to be used for anti-anxiety. Now, there are some medications that I often see as a urologist that can sometimes cause these issues. Now, it's not across the board, so I'm not saying these are bad medications, but there are a subset of people who really suffer from decreased desire when taking these medications. Now, this includes oral contraceptives for women, and the way this works is because oral contraceptives cause an increase in sex hormone binding globulin, and sex hormone binding globulin binds up testosterone. And in fact, women have more testosterone in their bodies than they do estrogen. And testosterone is not only an important hormone for desire in men, but it's also an important hormone for desire in women. So when they take oral contraceptives, they see this problem. The other one in men often is things like finasteride or dutasteride, or Propecia is the brand name. These are medications that are used either for an enlarged prostate or for hair loss. And these work by blocking the conversion of testosterone to dihydrotestosterone. And these can cause changes in your hormonal milieu that can lead to decreased sexual desire. When was the last time a doctor spent an hour with you and truly focused on what your goals are? When was the last time that you left the doctor's office feeling like you really understood what's going on with your body and had a clear plan of what was going to happen next? At my practice, Rena Malik, MD, I aim to give you just that. I specialize in sexual dysfunction, bladder conditions, hormone management, and pelvic pain for all genders. And I want to revolutionize how we take care of patients and really get to know each and every one of you. That's why at my practice, when you come to see me, I'm 100% present with you for an entire hour. And after you leave, if you forgot to ask me something or need clarification, don't worry, I'll respond to your issues and concerns quickly through our secure messaging portal with no extra fees or hidden costs. You don't even have to call the office to make an appointment. Just go online at www.renamalikmd.com/appointments and schedule your appointment today. We see patients in Newport Beach, California, and virtually for patients located in the states of California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. If you aren't located in those states, consider making an educational visit where we can talk about your conditions generally, but I can't diagnose or treat you as a patient. I can't wait to see you. Now, other things that can affect desire are relationship issues. If you're having relationship issues with your partner, it's very common for people not to feel desire for their partner because they may feel resentment or discouragement or unhappiness when they see their partner. And that ultimately doesn't lead to wanting to have sex with them, which makes total sense. Also, stress, fatigue, things that are ongoing in our lives will decrease desire because when you are stressed, your body increases the release of cortisol. Now, cortisol is released all the time in our bodies when we're doing stressful things, when we're working out, but usually it goes back to normal. But when you have chronic release of cortisol due to chronic stress, that inhibits the production of testosterone. That by nature of decreasing testosterone in both men and women will decrease desire. So it's really important to work on reducing stress in your life. Now, the more important things that when you see a doctor need to be ruled out are things like psychiatric or psychological disorders. So depression and anxiety are huge inhibitors of desire. And as I mentioned earlier, the medications that you take for these issues often have side effects that lead to low sexual desire. It's important if you are taking any medications for depression or anxiety and experiencing low sexual desire to talk to your doctor that prescribed them, because very often it's a dose-dependent phenomenon. Now, what that means is that as you get a higher dose, you're going to have more decreased desire. And so you can either continue taking that medication at a lower dose or try to find another medication that doesn't often have those side effects. Now, one of the medications that we often recommend is Wellbutrin or bupropion, which doesn't seem to have as significant side effects as some of the other options. Now, the other issue that's important to rule out is other what we call endocrinopathies, and that means other abnormalities in hormones within your body, commonly things like low testosterone or having abnormal thyroid function or abnormal prolactin. These are hormones that are related to the hypothalamic pituitary axis. So when you have abnormalities in any of these, they can affect sexual desire. And so getting these treated can immediately improve sexual desire. Now, immediately meaning that after you've gotten normal levels or the endocrinopathy is corrected, you may see improvement in your sexual desire. Now, other issues or other medical problems have been associated with low sexual desire. These can include stroke, diabetes, high blood pressure, post-traumatic stress disorder, which is sort of a psychological condition but more specific, seizure disorder, renal failure, heart disease and heart failure, and HIV. Also, eating disorders and doing significant endurance exercise and eating disorders can cause real major problems in your hormonal environment, which can lead to decreased desire. Now, the way diabetes can affect desire is it can also lead to decreased genital sensation. So you can actually find that things that used to make you aroused or certain pressures or types of stimulation on the genitals that used to give you arousal no longer does. And when you don't feel that, it can make you less interested in having those sorts of activities because you're not getting the same outcome. Now, this leads me to discuss that if you have other sexual dysfunctions, which are very commonly associated with low desire, it can create sort of a feedback loop. So, for example, in men very often, if you're having erectile dysfunction or premature ejaculation, you can start having a lot of stress and anxiety around having sex. And then when you come around and try to have sex the next time, you're preoccupied with the idea that am I going to be able to last long enough or am I going to be able to keep an erection? And that will then decrease your desire for sex. In women, if you have other issues like genitourinary syndrome of menopause, which I talked about on my last solo episode about estrogen, or you're having urinary incontinence, or you're having pain with sex, or other abnormalities in your function down there, even urinary leakage, it can make you have less desire because you find yourself either having discomfort or feeling less desirable. And that's also where body image issues can come into play. If you are having concerns about being unhappy with your body image, you're going to have less desire to proceed with sex because you're worried about how your partner may perceive the way you look. And I think the important thing to take away is that sex, the most powerful organ of sex, is your brain. It's not your genitals, it's not your penis, it's not anything else, it's your brain. When you have an orgasm, it's a completely mindful moment, which means that when you orgasm, you can physically not think about anything else. You are in the moment and completely mindful. And so if you can't be mindful during sex, meaning you can't stop thinking about all the things you have to do or the way you look or the pain you're having or whatever it is or how much you hate your partner that day, then you're not going to be able to be mindful and enjoy sex. And that may translate for you as low desire. Now, interestingly, pregnancy and childbirth, around that time, there is a significant change in women's body. And in fact, in a study of women resuming sex after giving birth, they look at 3 months and 6 months. At 3 months, the rates of either pain with sex or low desire are as high as 80%. And when you go to 6 months out, it's still upwards of 60%. So what does that mean? And why does that even happen? Well, one, of course, you're sleep deprived, you're busy taking care of a child, your body has changed, and those things can definitely affect you. And I can tell you that, I've had 2 children, and during that time, particularly that first year after having children, you are so sleep deprived the last thing you really want to do is have sex, particularly if you're lactating. Your breasts are uncomfortable, your nipples are uncomfortable, and it can cause a low estrogen state in the vagina. So what that means is that you can have thinning of the vaginal tissues, which can make lubrication less, which can make sex more uncomfortable. And then, of course, you don't want to have sex if you're going to be uncomfortable. Now, the good news is that if you are experiencing pain with sex during that period, there are many options, particularly vaginal estrogen, that can help with thickening those tissues so that you don't have discomfort with sex and that you have more increased lubrication. You can also use vaginal moisturizers, or you can get assessed by your urologist or gynecologist for pelvic floor dysfunction, which can happen after giving birth. Because after giving birth, very often you can have weakening of the pelvic floor just from having carried that baby for 9 months or pushing it out through the vaginal canal. Alternatively, sometimes people develop pelvic floor dysfunction because of all the stress related to taking care of a newborn. The pelvic floor can tense up and cause pain and discomfort. And both of those can be treated with pelvic floor physical therapy. Now, let's talk about men for a second. Very often people automatically think low desire, low testosterone. Now, that's common, but it's not the only reason for men to have low desire. Now, based on research, we know that when testosterone on average dips below about 432 nanograms per deciliter, men will start developing symptoms of hypogonadism, specifically low libido. In order to have issues with erections, the average testosterone that we're seeing men having issues is below about 230 nanograms per deciliter. Now, I tell you these numbers, but you are not a textbook, and people may experience symptoms at higher levels of testosterone, and it's very reasonable to evaluate that and then assess if you have response to testosterone replacement therapy. And testosterone is not only beneficial for sexual function or desire, and we have androgen receptors all over our body. It's important for cognitive health, mood. It's important for bone health and muscle mass. So there's lots of benefits to testosterone. So if you have low or borderline low testosterone, it may be valuable to consider either natural ways to boost testosterone or considering testosterone replacement therapy. Now, I will make a dedicated podcast on testosterone, but briefly here, testosterone can be replaced in a number of different ways. It can be treated most commonly either with topical gels or topical patches. It can be given by injection therapy, so given injections twice a week, every week, and there's different formulations of that. There's also testosterone oral therapies and nasal sprays. There's also pellets that you can have implanted inside your body that will release testosterone for up to 3 to 4 months, and then you get them replaced. So there's lots of different options for testosterone replacement therapy, and it can be very beneficial in all areas that I discussed. So for mood, for cognition, for bone health, for increasing muscle mass. And so if you are having issues in these areas, like you're feeling depressed, have low energy, have issues with desire, have difficulty getting muscle in the gym, even though you're lifting a lot of weights, it may be a sign of low testosterone. And so it's important in these cases to get evaluated, and if you're a candidate, decide with your doctor if testosterone replacement is right for you. And then make sure you continue to be followed. Testosterone therapy is not something you just take and then you just manage it on your own. We have to evaluate, 1, that your testosterone is improving, 2, that your symptoms are improving, and 3, that you're not having any adverse events or effects of taking testosterone. Now, there can be side effects with testosterone, particularly if it's too high. That can be things like acne. It can cause erythrocytosis or increase in your blood cell count, which is a problem. It can cause a slight increased risk of stroke. And so these are things that we need to sort of evaluate, make sure testosterone doesn't go too high or become super physiologic where it can become detrimental. Now, the other important thing to realize is that testosterone works on testosterone receptors. So at some point when those receptors are fully saturated, now we don't know what that point is for every individual. We don't have a way to test it. But above and beyond that, more testosterone is not going to be better. And so it's important to realize that, like, okay, you might feel good, but taking more may not make you feel better and may just give you harm. Are you loving the Rena Malik MD podcast? Well, I love each and every one of you, and I'm truly honored that you choose to spend a bit of your day or a bit of your week with me. Did you ever hear the actual story of why I started making content online? Well, when I was a resident, I remember having a patient who had bladder cancer. And in order to treat her bladder cancer, we had to remove it and then reconstruct a new bladder called an Indiana pouch. Now, with this new bladder, she would have to catheterize herself through a stoma or an opening on her abdomen in order to empty her bladder. So after surgery, immediately she did great. She went home and no major issues. But subsequently, over the next couple months, she started getting readmitted over and over again to the intensive care unit. And we were really wondering what was going on. Eventually, we figured out that she didn't truly understand that she now had to catheterize herself to empty her bladder. Just the simplest thing that was so pivotal, she didn't understand that. And it was then that I realized as a urologist, I could do the perfect surgery. But if my patient didn't understand the consequences of that surgery, then I failed as their doctor. And once I started practice, I realized that I couldn't teach people everything they needed to know in the 15 or 30 minutes I saw them in my office. And that's when I started creating all my Rena Malik MD content to offer free education to people around the world. And I can tell you that it has been truly one of the most rewarding experiences in my life. And in order to keep providing free content, we need your help. If you are getting value out of this podcast or my other content, I encourage you to join our premium membership. As a member, you'll get early access to the audio and video of the podcast completely ad-free, transcripts of all the episodes, and exclusive access to Ask Me Anything episodes that occur once a month. And during those episodes, I answer questions that are asked only by premium members. So join us today at renamalik.supercast.com. Can't wait to see you there. Now, what about men who have normal testosterone levels? Now, in men who have reduced libido, and have sort of always been that way, or as long as they can remember, but they have normal testosterone levels, there's actually been a study that looked at what things are more correlated with these types of men. And what they found is these men tend to have more postgraduate school education, so they're highly educated. They have more problematic relationship issues or family issues. Specifically, they may have a partner with reduced libido or a partner who doesn't climax as often. They tend to actually be quite healthy. They have really good glycemic control, meaning they have very good blood sugars and low triglyceride levels. And they tend to have more of what we call somaticized anxiety. So they may have issues like abdominal pain or headaches or physical manifestations of their anxiety. And so this sort of tells me that all of these issues are probably all causing problems within libido. And so in these cases, it can be very valuable, and we'll talk about this a little later, is to seek the care of a sexual therapist or a psychologist with expertise in low libido or low desire. And in these cases, it can be very valuable to seek the care of a sex therapist or a psychologist who has expertise in sexual medicine to help you kind of figure out and navigate these complex issues and optimize the relationship conflicts and optimize the anxiety so that these issues have less of an impact on low desire. But what else can you do? So let's talk about in all genders, what are things that can help? Number one is sleep. In today's society, sleep is not prioritized. In fact, in Matt Walker's book, Why We Sleep, he mentions that we're the only species that actually actively tries to not sleep. Every other species actually goes to sleep at the normal time based on the circadian rhythm. Now, it's not completely our fault, right? We're surrounded by bright lights and we're not outside as much as we used to, so we're not getting exposure to the sun that tells us it's morning time or it's nighttime, and so our brains are still wired and wide awake at nighttime. And now with the advent of phones, we're often scrolling our phones before bedtime, which doesn't help us fall asleep. And more stress in today's society is causing us to ruminate right before bedtime when we finally let ourselves think about what's going on in the world, and then people have more trouble sleeping. Now, we know quite significantly that sleep deprivation can lead to mood issues, including depression, anxiety, and low libido. and particularly even obstructive sleep apnea. So when you look at men who have obstructive sleep apnea, about 23 to 25% have low libido. So getting your sleep apnea treated can actually help your libido. Now, how would you know that you have sleep apnea? So very often, if you have a very thick neck circumference, that's a sign that you may have sleep apnea. Also, if you find that your partner is telling you that you wake up in the middle of the night and gasp for air and then fall back asleep, that may be a sign that you have apnea. And also, if you're really tired all the time during the day, you're falling asleep or having issues with staying awake, that's another indication to see a sleep specialist and get your sleep evaluated. Now, there have been a couple studies that have looked at sleep deprivation and its effects on testosterone. Now, these studies are primarily done in young, healthy men, but they look at men who sleep for maybe 5 hours a night and compare them to men who've slept for 8 hours a night, and they see a significant decrease in testosterone. Now, it's not consistent across all studies. We do know that if you have acute sleep deprivation, like you don't sleep for 24 to 48 hours, that you're going to see decreases in testosterone. But based on the data we know about low testosterone, the number one thing you can do to improve your hormones is to sleep and get good quality sleep for at least 7 hours. So that's uninterrupted sleep, good quality sleep, meaning minimizing your caffeine intake so you don't have caffeine on board prior to bedtime. And that means actually afternoon, because if you take or drink coffee or have any sort of caffeine afternoon, the half-life is about 5 to 6 hours. So you could still have caffeine on board at around midnight when you're trying to go to sleep or even earlier. So it's really important to try to minimize caffeine intake afternoon. You will see a difference in your overall sleep quality when you reduce your caffeine intake. Alcohol late also will affect sleep quality. Of course, as I mentioned, looking at blue lights prior to bedtime, looking at screens or TVs will affect your sleep quality as well. So trying to have a very dark environment in your bedroom and then trying to get outside in the early morning to expose yourself to sunlight and expose your eyes and your brain and your body to sunlight to kind of let yourself know that it is morning time, it is daytime, will help you be more arousable during the day. The next thing you can do is exercise. Now, think about exercise, right? When you exercise, your heart rate increases, your respiratory rate increases, and also you activate your sympathetic nervous system. Now, this is your fight or flight system. Think about when you're aroused. Your heart rate increases, your respiratory rate increases. So this can actually increase arousal. Even one-time acute exercise can increase desire right after exercise. Now, in terms of chronic exercise, there's lots of benefits. One is that it can improve body image, right? So if you're having body image issues, they will actually alleviate them because now you look good and you feel good. The other thing is it actually increases blood flow. It increases blood flow throughout your body, but also in your genitals. And so that can, over time, allow you to be more arousable when you're trying to have intercourse. It also causes stress reduction, increases energy, and allows for better sleep. When you work out, you're more tired when you get to bed and you can have better quality sleep. But we also know that exercise improves testosterone and other hormones. So when you do exercise, particularly resistance exercise with heavy, large muscle groups and heavy weights, you can actually see boosts in testosterone, which can then improve overall desire. If you do very strenuous endurance exercise, this can actually, over time, cause decreased desire. And this is because it will cause chronic cortisol elevation, which can then cause decreases in testosterone and decreased desire. So it's important to do moderate intensity exercise. You can do moderate high intensity exercise at times, but not all the time. And you want to include resistance training into your regimen for optimal desire and optimal sexual health. The next thing to consider is meditation. Now, meditation is the act of going about things without judgment. So going through activities without any judgment. So when you are having sexual activity, things may happen, but not placing any judgment on them. Now, this takes practice. You can't just practice mindfulness during sex and expect it to work. So very often people will do mindfulness meditation to help sort of build that skill. And how does it actually help? Well, one, it actually reduces issues about body image because you're no longer focused on the way your body looks. You're actually focused on pleasure and how things feel during sexual intimacy or sexual intercourse rather than thinking about what your body feels like. You're completely present during the act. In fact, they did a study of about 1,000 undergraduate college students, and they found that people who did practice mindfulness had better self-perceived performance during sex and self-perceived body image. And there's also a bunch of studies that have looked at mindfulness in helping sexual dysfunction. In fact, in a study of 1,700 women, they saw that women who practiced mindfulness had lower sexual dysfunction and overall better satisfaction with their sex lives. And particularly when looking at women who actually had sexual dysfunction, implementing mindfulness-based therapies caused improved arousal, increased desire, and increased lubrication. And they generally help decrease fear around sex. Now, this can be common when you have sexual dysfunction. There can be a lot of fear around, is it going to hurt? Is it going to feel good? Am I going to orgasm? Whatever it is. And so having mindfulness practices and incorporating them in the bedroom can actually help you not be scared and actually just take things as they are. Now, what about food, right? So people talk about foods all the time. They say, eat oysters, eat this, eat that. And these are aphrodisiacs. Now, some of the reasons they will suggest that foods work is because they're shaped like genitalia and they allow you to help sort of think about genitalia and may increase arousal. Sometimes they talk about spicy foods because they're hot and they make you, again, have maybe a little increased heart rate, a little increased respiration, and may increase desire. Now, these haven't really been studied, so I can't tell you if they work or don't work, but there's no real physiologic mechanism for them to work. The other things that they will recommend are foods high in zinc or magnesium. Now, these things, when they are deficient, when you don't get enough zinc or magnesium, can affect your hormones. And so in people who are deficient, increasing zinc or magnesium through food can benefit their overall testosterone levels and subsequently improve desire. And so if you're looking for foods that have, more zinc, you can think of things like oysters, shellfish, or fatty fish are high in zinc. You can also Google what are foods that are high in zinc or magnesium and consider trying to incorporate them in your diet or otherwise take a zinc or magnesium supplement. Now, the other things that you could try to do, again, are not always feasible for everybody, but can make a big difference. We know that sleep and stress can affect sexual desire, as well as issues with privacy. So if you can try to reduce your hours at work or get help at home with childcare or household duties, you may notice that freeing yourself up allows you to have more desire for sex because you're not stressed about something else. If you don't have a lock on your bedroom door, get one on your bedroom door. Then you're not worried about your children or someone else walking in the bedroom while you're trying to be intimate with your partner. Another thing is desire, right? People think that desire needs to be like we see on the movies. You see your partner, you're like, oh my God, they're so hot. I can't wait to jump them and have sex with them. But that tends to fade over time. And not everyone has this, what we call spontaneous desire. And certainly it can wax and wane. There can be times in your life where that's exactly true, and other times, particularly when you're in a long-term relationship, where that's no longer the case. And so what you may have is responsive desire. And so what that is when you actually get aroused, like you lie together, you touch each other, you cuddle, you feel a little bit like, oh, I used to like that. And then you start feeling desire, like, oh, I want you now that we've started touching or kissing or snuggling. It's actually awakening that desire in me. And that is completely normal. But in order to have that happen, you need to dedicate time to snuggle, be intimate, right? Otherwise, it's not going to happen. And we are so good at scheduling everything else. Look at your calendars on your phone or wherever you keep your calendar. You will see you've probably scheduled brunch dates. You've scheduled all your meetings, your doctor's appointments, maybe your workout time. But have you ever thought about scheduling time for intimacy with your partner? Now, when I talk about this, a lot of people are like, that sounds so weird. Like, I don't want to schedule sex. And it's not about scheduling sex, right? It's about scheduling time to be intimate. Think about when you were in high school or college, and maybe you didn't have a place to go meet your partner, or maybe you had to arrange a place to meet your partner because you didn't own your own place. And so you would set a date to see them. You'd get super excited. You'd prepare, right? Women, you'd shave. Guys, you'd take a good shower, get your good cologne, whatever it is, right? You'd prepare and you would be super excited. You'd be like, oh my God, I'm going to see them. It's going to be so hot and whatever, right? And and so you got excited. You were ready for it. And then when you saw them, you were amped up. You were like, oh yeah, I can't wait. I can't wait to kiss you. I can't wait to be with you. And then it was even more exciting. So scheduling time for intimacy in the beginning, it might be like, wow, this is a little weird. But if you accept it as like, hey, we're just being together. Date night doesn't have to be going out to dinner. Date night can be being intimate in the bedroom or getting a hotel room or whatever you want it to be, but actually scheduling time to be together. Now, it doesn't have to be scheduling sex because scheduling sex puts pressure on people. It can put pressure on someone who maybe has lower desire and feels like, what if I'm not into it? I have to have sex. It can put pressure on somebody with sexual dysfunction if they're stressed about having to perform. And so you don't want to schedule sex. You just want to schedule time for intimacy. And if intimacy leads to sex, that's great. And ultimately, likely it will, but it may not happen the first time you schedule it. Bottom line, this is a great way to reinvigorate your sex life. And sometimes people have it like it's not so written in stone, but you know that when your partner puts on a movie for the kids, that you guys can leave the kids alone and they're not going to bother you. And that's a great time where you can go be intimate together. Or whatever the situation is, the kids are at whatever, a game or a sleepover or whatever. This gives you the opportunity to try and be intimate together. And in the same vein, you actually have to talk to each other, right? So we were never taught to talk about sex. We never did. No one taught us how. It is super awkward because we just never talk about it. And so if you don't tell your partner like, hey, I'd love to just have this time with you, can we just kind of have this time to be intimate and try this? And they have to be on board, right? Because if you go in all excited and they're like, what are you doing? You didn't talk to me about this. I thought we were just going to go have dinner like our usual date night. They may be a little put off and that may just turn you off, right? You might be like, oh man, I was so excited and they didn't go with it. Well, you never talked to them about it. How are they going to know? And talking can't be right in the moment. It has to be prior to the event. You have to talk in a neutral location, so not in the bedroom, usually like in the kitchen or ideally when you're on a walk or driving together where they can't escape you. And you can start having a conversation and realize that talking about sex is awkward. People often feel attacked or feel very awkward about it. And so they may not respond the way you expect them to, but give them time and give yourself time. It's a skill that takes practice. So vibration actually causes blood vessels to dilate or stretch out and allows increased blood flow to the genitals. So when you use toys or aids that have vibration, you will notice that there may be increased blood flow to the area that will then allow this increased arousal. Now, that's not going to necessarily automatically lead to desire, but it may enhance it somewhat. And not only will it increase desire, but it may improve orgasm quality. So something to consider trying out. Like I said, it's not specifically designed for desire, but if you're having difficulties with orgasm, that can obviously lead to decreased desire. And so incorporating vibration can improve orgasm quality and make you more excited then to have more orgasms and have more sex if you're having stronger orgasms. So interestingly, there's actually been studies that have looked at women, adult women, and they've found that in those women who've used vibrators in the last month, they actually reported higher sexual desire scores on a validated questionnaire called the Female Sexual Function Index. Now, this is a validated questionnaire that's been studied rigorously that correlates with issues of desire. It has multiple dimensions in it, but it does have specific questions for desire that correlate with the presence or absence of hypoactive sexual desire disorder. In men as well, they've studied vibration and they found that it improves a validated questionnaire called the IIEF, or International Index of Erectile Function. Now, this is not necessarily specific to desire, but that means that they're having better quality of erections and more confidence in erections, which is also a great plus. And they also looked at sexual desire, and they found that those men who used vibrators had higher sexual desire scores than those who had never used vibrators. Now, of course, people who use vibrators may be different than people who don't use them, right? They may actually have more interest in sex. They may actually be more open to trying different things during sex and may be open to talking more about sex and have better communication skills. So it's not a perfect study, but certainly a reason to try new novel things. Now, new novel things or novelty in the bedroom or with sex can actually increase desire, right? Boredom occurs when you do the same routine over and over again. But when you introduce novelty, that can make things more exciting and then enhance desire. So whether it's vibration, whether it's mutual masturbation, whether it's trying different positions or introducing things in the bedroom that maybe you haven't tried before to change, enhance, or alter sensations like feathers can be helpful. Now, what about supplements? Everybody wants to know, are these gummies and pills and whatever that's out there going to improve sexual function? So I'm going to talk about some supplements that are very often seen in these formulations. Now, the most common one is called maca. So maca is essentially a cruciferous vegetable, and there's 2 different species of it. And they've looked at it in terms of sexual desire. Now, people say this is great for sexual desire, but I actually looked at the studies. And the first study was done on 8 endurance athletes, young, healthy men, who received maca. And these men who got 2 grams of 5-to-1 maca over 2 weeks had higher rates of self-reporting, meaning they felt their libido was better. Now, they did the study to assess if it would improve their cycling performance, which it didn't, but it did tend to improve libido. Now, they've also looked at it in a study for women, but these women tended to have sexual desire decrease due to SSRIs or medications, and it was effective in these 45 women. But again, it was not necessarily all women with low desire. The next one is ashwagandha. Now, this is a stress-relieving adaptogen that's from Southeast Asia, Middle East, India. It's known as Withania somnifera from a family called withanolides. Now, it's believed to have antioxidant, anti-inflammatory properties, but the big thing is that it reduces stress by reducing cortisol levels. And so when you think about things that reduce cortisol levels, cortisol is basically works the opposite of testosterone. So when cortisol is up, testosterone goes down and vice versa. So decreasing cortisol levels can improve testosterone. But of course, there's other benefits to reducing stress, right? Reduced stress is a big factor in decreasing desire. So ashwagandha has had some purported benefits in increasing libido. So there's been a couple studies. The first one was done on women, and it was 50 women who got ashwagandha, or what's called KSM 66, compared to placebo. They got 300 milligrams twice a day, and their improvement was assessed on that same validated questionnaire called the Female Sexual Function Index. And they saw improvements in arousal, lubrication, orgasm, and satisfaction, and even the number of successful sexual encounters in the women who received the ashwagandha after 8 weeks. Another similar study was done in men. Again, 50 men that were randomized to receive the same ashwagandha KSM 66 versus placebo, and they were then again assessed after 8 weeks in terms of their testosterone levels, their prolactin levels, as well as a questionnaire about sexual function. They did see an improvement in testosterone levels as well as overall sexual function. Now, these studies are really small. They're typically done by people who are associated with those that will be selling the compound. And so take it with a grain of salt, but it may be useful if you're experiencing stress and may be worth trying for a short period of time, cycling on and off. I would not continue taking ashwagandha for long periods of time because we don't want long-term reductions in your body's cortisol production. Also, you ideally don't want to take it first thing in the morning because that's when you have a natural cortisol spike. And we actually want that, right? Now, what about pharmacology? So I already talked about testosterone replacement, which can be very effective if you have low testosterone. Now, women can also use off-label testosterone. As I mentioned before, women have more testosterone in their bodies than estrogen. And when they have decreased testosterone, they actually get decreased desire. So at the same level that men get, they have about 1/10 of the amount of testosterone that men have. So when we replace testosterone, the most common option that's used is typically a topical cream or gel at 1/10 of the dose of men that's rubbed in on the back of the calf, the upper thigh, or the outer buttock. And it has been shown in studies to improve desire. But essentially, it's really important to assess blood levels with testosterone as well as symptom improvement when getting off-label testosterone, because it is delivered transdermally and not everybody has good uptake transdermally. Now, pellets are not recommended for use in women at this time based on guidelines. There's also 2 medications that are FDA approved for premenopausal women with low desire. Now, we use these off-label for postmenopausal women as well as men. The first one is bremelanotide. So bremelanotide was FDA approved in 2019, and it's a melanocortin receptor agonist. It's basically administered what's like an EpiPen that you give yourself about 45 minutes before you want. Now, most people, it works within 45 minutes. Some people, it does take longer. And so it's important the first time you take it to kind of figure out what that timing is, because it may be useful to figure that out. It can last for 24 to 48 hours. So important to I tell people, do it on a weekend where you can have a lot of sex, like your partner's ready for it, you're ready for it, and just see how it works. Now, it does have some side effects. The most common one is nausea. Up to 40% of people who take it get nausea. So often I will prescribe Zofran, or what's called an antiemetic, at the same time so you can take it and ideally avoid the nausea. Or you could try it once, see how you feel, and if you do okay, the next time you can either take the Zofran or not. People can also get flushing, headache, and hyperpigmentation. Now remember, it's a melanocortin receptor agonist. But the only people who get hyperpigmentation based on the studies were those who took more than 8 doses a month. So if you took more than 8 doses a month, then you were more likely to get hyperpigmentation. So it's not recommended that you take it more than 8 times a month. The other medication is called flibanserin, or Addy. Now, this is an oral medication that is both a serotonin receptor agonist and antagonist. It works on different serotonin receptors at the brain level to help improve desire. This is a medication you take every single day before bedtime, 100 milligrams once a day at night before bed. It has the added benefit of maybe increasing your sleep quality because it does make you a little drowsy. So you don't want to take it at other times. You also don't want to take it if you've had more than 2 alcoholic beverages in an evening within an hour or 2 of taking the medication. Now, flibanserin works in about 60% of people who take it, and it can take about 3 months to see full effect. And the effect is not quite as marked as you would if you took something like bremelanotide, which would give you instant increased desire. This is going to be like, oh, I was doing the dishes and all of a sudden I thought about my partner and I was like, oh, I kind of want to go have sex. Or I saw something on TV that made me want to have sex and I haven't felt that way in a long time. So it will give you sort of a slow increase in desire over time. Now, side effects are pretty low. Most commonly is feeling fatigue or somnolence, like you're very tired. A small subset of people, less than 2%, felt nausea or dizziness, and so overall pretty well tolerated. In addition to increasing desire, it also increased lubrication, desire, orgasm, overall satisfaction, and decreased pain associated with sex. So when it works pretty well. Interestingly, they did a subset analysis, and they also saw that about 20% of people saw at least a 5% reduction in weight, which was sort of an added benefit to taking this medication. Another off-label medication is bupropion. Now, bupropion is an antidepressant, but when used for off-label reasons for increasing desire, they saw about 63% of people showed an increase in sexual desire after taking bupropion. And interestingly, it actually showed more improvement in men than women. About 86% of men saw an improvement in sexual function compared to about 40% of women. And people generally had mild side effects, which included weight loss, nausea, agitation, and insomnia associated with taking the medication, but overall very well tolerated. And lastly, off-label is DHEA. So DHEA is what we call a prohormone, and this is broken down into a number of hormones, one of which is testosterone. And it has a multitude of effects, including improvement in libido and arousal. Now, the issue with DHEA is it is not regulated. So it's in the supplement market, which is unclear if things are exactly what they say they are on the bottle. So when we look at studies looking at variability in supplements compared to what's on the label, you can sometimes see variability as little as very small percentages of the item on the bottle up to 400% of the dose that's on the bottle. So we cannot really recommend DHEA supplements, but vaginal DHEA for women, alprasterone, has been shown to improve sexual desire, particularly in postmenopausal women who are suffering from low estrogen symptoms or genitourinary syndrome of menopause. I hope you guys enjoyed that podcast and learned so much. Please do me a favor and comment on the YouTube video on what else you want to learn about on the podcast. Are you enjoying the podcast? Do you have feedback for me? Because I would love to hear it. And if you are enjoying the podcast, a great, completely zero-cost way to support our podcast is to share my podcast with your friends and family. The more people we get to listen, the more people we can give evidence-based, accurate information about their health. You can find the podcast on any podcast platform as well as on YouTube. And you can also find me on Instagram, Facebook, TikTok, Threads, and any of a variety of social media platforms where I create more short-form content, more content about my personal life, and what it's like to be a urologist. And as always, remember to take care of yourself because you're worth it.